Let's discuss one pharmaceutical calculation regarding creatinine clearance that is important to calculate dose of those drugs that are cleared renally. So we have to use Cockcroft-Gault formula, that is according to APF, cret clearance is equal to 140 minus age into ideal body weight divided by 0.814 multiplied by serum creatinine in micromole per liter. And we have to find creatinine clearance for a patient with age 66 years, height 175 centimeters, weight 68 kg, and serum creatinine 144 micromole per liter. So in according to this formula we have to calculate ideal body weight. Ideal body weight is equal to, in case of male it's 50 plus 0.9 into every centimeter above 152 centimeter. So ideal body weight will be equal to 50 plus 0.9. We got the weight of we got the height of 175, so 175 minus 152, it will be 37. So 37 into 0.9, it will be 33.3. We will take it no positive 33.3 and we'll add it in 50, so it will be 83.3. I'll check my calculation again. 152 minus 175, it's 23, not 33. Sorry, no, sorry, not 37. So it's 23 into 0.9, that will be 20.7 minus 50 to add it up, and it will be 70.7. 70.7 kg. 70.7 kg, if you compare it with actual weight, that is 68 kg. So it is, the ideal body weight is actually more than that of actual weight, or there is just difference of 2 kg. So we will use this value. What's the formula? Here is the formula. We will directly put values. We have already checked the weight, ideal body weight, but we will not use ideal body weight because actual weight is less than ideal body weight, so we will use actual weight. So 140 minus age is 66 into body weight, that is 68, divided by 0.814 multiplied by serum creatinine in micromole per liter, that is 144. So 140 minus 66, it will be 74, multiplied by 68 divided by 0.814 into 144 is equal to 74 into 68, 5032 divided by 0.814, sorry, 0.814 multiplied by 144, it will be 117.225032 divided by 117.22, it will be equal to 42.9. And what will be the unit? Ml per minute. So this is our answer. Next question is, doctor wishes to switch a patient from leothyronine to thyroxine and would like to hear your recommendations. Patient is currently taking leothyronine 15 microgram 3 times daily. Given that leothyronine, if you take leothyronine 20 to 25 microgram, it will be equal to thyroxine 100 microgram. So let's choose any of the figure in between 20 and 25. That is, let's suppose it is 23 microgram. That is equal to 100 microgram of thyroxine. We have to calculate that how many microgram of thyroxine will be equivalent to 15 microgram. Okay, we will stop reading question till this point and we will solve this problem. We'll do cross multiplication, 15 into 100, and we'll keep the 23 here and x on the other side. So if you multiply 15 with 100, it will be 1500, and then divide it with 23, answer will be 65. X is equal to 65.217 microgram. Now we'll read further. Suggest a suitable daily dose of thyroxine of this patient. And we have seen that its leothyronin dose was 15 microgram 3 times a day, and this is the dose equivalent to 15 microgram. That was the one time dose only, so we will multiply 65.217 with 3 and we'll get the answer of 195.65. It's difficult, so you can just give 200 microgram a day. Okay, so doctor calls you and he has one concern as he is shifting one patient from propylthiouracil to carbimazole and needs your intervention about it. So PTU, that is propylthiouracil 1.5 tablet 3 times a day, is the previous dose of the patient. 50 milligram of PTU propylthiouracil is equivalent to 5 milligram of neomercazole, that is carbimazole. Okay, this is the equivalent. Patient is taking 1.5 tablets of 1.5 tablets of propylthiouracil. Now, one tablet is equal to 50 milligram. So 50 multiplied by 1.5, it means 75 milligram at one time. At one time. 3 times a day. So we will further multiply it with 3. 75 multiplied by 3. Answer will be 225. 225 milligram. So total daily dose is 225 milligram. We have to find that what will be the dosage for carbimazole. Cross multiplication, 50x is equal to 5 into 2 to 5. X is equal to 5 into 2 to 5 divided by 50. So answer will be 22.5 milligram. This is in milligram. But what about number of tablets? So one tablet of carbimazole, that is neomercazole, is equal to 5 milligram. 22.5 milligram will be equal to how many tablets? Cross multiplication again. 22.50 into 1 is equal to 5x, implies that x is equal to 22.5 divided by 5. What if we divide 22.5 with 5? Answer is 4.5 tablets. So 4 full tablets and 1 half tablet is needed to be. We have 2 more questions for this video. Okay, let me drag this question a little away. Set. So prednisolone 5 milligram is equivalent to dexamethasone 0.75. Prednisolone 5 milligram is equal to 0.75 milligram. Patient is taking 25.5 milligram of prednisolone. How many milligram of dexamethasone will be required for equivalent anti-inflammatory effect? So cross multiplication again, 5x is equal to 0.75 multiplied by 25.5. Rx is equal to 0.75 into 25.5 divided by 5. Now we have to solve the equation. 0.75 into 25.5, that will be equal to 19.125. Divide it with 5 and answer is 3.825. 3.825 milligram of dexa. Similar question here we have. Let's solve this one too. So cortisone 25 milligram is equal to methylprednisolone 4 milligram. If patient takes 37.5 milligram of cortisone, then what will be the equivalent anti-inflammatory dose of methylprednisolone? Cross multiplication again. 25x is equal to 4 into 37.5. Rx is equal to 4 into 37.5 divided by 25. X is equal to 4 into 37.5 equal to divide by 25. Answer will be 6 milligram. Right, this is the dose of methylprednisolone that will be equivalent to 37.5 milligram of cortisone.